Can you just introduce yourself real quick to our class?
Sure. I am Kim, and I'm a pediatric physical therapist.
All right. And how often do you work with children with cerebral palsy?
Every day.
Every day.
Yes.
And does that affect their behavior?
It does. So a lot of times their cognition isn't affected, so they act out because they're frustrated, especially children who all four limbs are affected, quadriplegia. They want to do things that they can't do, so they act out and they'll hit, they'll bite, they'll spit. So a lot of times you have to use behavior plans with them, working towards something that's motivating for them.
Really good. That's awesome. How are their gross motor skills affected?
It depends on the level of infarct that they had, but some of the children can't walk, some can't stand, some just walk with like a slight limp. So it depends on the type of CP that they have and, again, the level of injury.
And there's 6 types, right? 6?
Yes.
6. Okay. And what are some of your strategies?
Well, sometimes it's the behavior plans. It depends on what our goals are and what we're working towards. If we're working towards walking or ambulation, we'll use different assistive devices. If we're working on just weight bearing and standing, we'll use a stander, special equipment to support them in the upright position. If we're working on power mobility in a wheelchair, we can be working on that. And then other kids just normalizing their gait pattern so that they're safe and they can navigate their environment.
And do you work with assistive technology at all?
I do. Some of the children have different communication devices. So I've worked with the Tobii, the Dynabox. Some of them just have communication booklets where it's picture symbols. Some will just use Big Mac switches. All kinds of things.
Does insurance cover the assistive technology, or is it really expensive?
It's extremely expensive, and yes, insurance usually does cover it, but it's a pretty lengthy process and requires a lot of documentation to support that the child needs it and proof that they actually will succeed with it. So they usually will have to trial a device first to see what works for them.
I didn't know that. And just to wrap up, can you just tell us an inspirational story?
Sure. I worked with some pretty severe children with CP, and they're some of my favorite ones to work with just because they don't always show or have large gains, but a lot of times we'll just give them everything to support what they can do. So one child that I worked with, we put in a gait trainer, which is kind of like a big walker, and they have a support around their chest, supports at their ankles, supports at their arms, and they were able to take steps in the gait trainer, which was really cool.
That's really awesome. Well, thank you for letting us ask you some questions.
You're welcome.
See you later.